Hello, we're answering questions on health and medical problems, and I'm joined by Dr. Rosemary Leonard. Hello.
Hello.
Rosemary, we have a question here from a 25-year-old woman who's found in her boyfriend of the same age a small lump on his testicle. Now, she says he keeps saying that he won't go to the doctor to get it checked out, or says that he will, but he actually hasn't been. So he's kind of trying to tell her that he's going to sort it out. She's really getting worried. She thinks he's too embarrassed to go, and he keeps telling her that he's sure there's nothing wrong and it's all going to be okay. And she wants to know, what can she do to get him checked out, to convince him he does need to go?
What century is this man living in? What is it about men and doctors? They're so scared of coming to see us. In fact, I'm seeing more men in my surgery with personal problems like this. And the vast majority of lumps in the testes are not cancer. I mean, I think what there is this underlying fear, oh my God, if it's cancer, I'm going to lose my testes. The answer is, chances are it's not cancer. A very common cause of lumps in the testes is actually infection or little cysts, which are very easily dealt with. What he needs to do is go along to his doctor. If he's got a female GP, and there's a lot of us around now, an alternative would be to go down to the Department of Genitourinary Medicine at his local hospital, where there are always male staff and he could be seen there. What he actually needs probably is an ultrasound scan to sort out what it is and to put his mind at rest, and he will be worried about this, and also to put her mind at rest as well.
Now, there have been huge advertising campaigns in the last few years. There's sports stars saying, get it checked out. Testicular cancer, hard to say, is one of those things that seems to be sort of cooler thing to sort out.
Yeah, and the thing is about testicular cancer, if worst case scenario this was testicular cancer, it is imminently curable. This is a cancer that can be cured.
If you get it early enough, I presume.
If you get it early enough, yes. Yes, he might need to have one of his testicles removed. But then man can function perfectly well and father a child on one testicle in the same way that women can have a baby with one tube and one ovary. And you can now get prostheses to go in the scrotum so it looks cosmetically as if they've got two. So really, he needs to go along
and get it checked out. And as you say, probably not cancer anyway.
Probably not cancer anyway, but you cannot be sure. You cannot be sure, so he really ought to go.
How would you suggest she tackle the problem? Because that's what she really wants to know. You know, give me a script, she's saying. What do I say to him?
I would suggest what she does. Sometimes I've had women who've actually made the appointment and then said, right, you're coming. They've made an appointment at the doctor at a time when they know it's as convenient as it can be. And they said, right, I've made an appointment, you're coming with me now. You know, take it out of his hands, as it were, and just say, you're coming now.
Fabulous. Thank you for answering that question, Rosemary. Well, if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.